When you think about the reality that 5 out of 100 Americans will develop colon cancer in their lifetime, there's really no excuse. We're happy to adopt technology that we've seen a real, not just a marginal, but a real benefit from, and Fuse is one of those technologies. Fuse, or really what I consider full spectrum endoscopy, offers us just what we need. And now we've seen a rapid evolution in this technology really in our first year of experience with it. And so we went back and we looked at the past few months of our experience with Fuse, and it wasn't just in a single position, but across the board we saw an increase in our detection rate. I think it's now a very exciting time for us, and has kind of breathed some new life into this concept that colon cancer really is a preventable disease. The wide-angle colonoscopy concept that the Fuse platform provides is literally an eye-opening experience. The major advantage is on the pullback, when we're really inspecting all of these folds that come across our way, and just knowing that seeing more is always better, and it's something that's very hard to argue with that concept. And so it would be very hard to now close the curtains and ask us to go back to the days where we just had one camera looking straight ahead. Just like we're bringing wide-angle cameras into our homes, and wide-angle televisions into our living rooms, the same trend will carry across into the field of GI endoscopy. We've changed our practice over the years, and we've recognized that patients have certain fears, but also that they're not just patients, they're customers, and we need to make them feel like they're getting good value and that they're getting a high-quality exam. Really, healthcare has now become a service industry, and I think that's great. And it's not just about the procedure, but it's about the whole patient experience. We've done a lot to make it really, truly painless. And so I would encourage anybody, certainly with a family history, but anybody over 50 or over who hasn't had a colonoscopy, to speak to their doctor about the options and to move forward. I would absolutely undergo a colonoscopy, and if I could find a colleague that was willing to do it, I'd ask them to provide a Fuse colonoscopy.